Hello and welcome. I'm Dr. Mary Collins from the RCSI Centre for Positive Health Sciences. We're delighted to welcome you to this webinar today to mark National Workplace Wellbeing Day. And I'm joined today for our conversation with Professor Ciaran O'Boyle, Founding Director of the Centre for Positive Health Sciences in RCSI, and also delighted to welcome Amy Gibney. Amy is National Coordinator of Grief in the Workplace and Grief Awareness for the Irish Hospice Foundation. So thank you both for being here today. And Ciaran, I might start with you, please. There has been so much research and the whole area of positive health is really evolving. Could you please share with us, Ciaran, just some of the progress we've seen around well-being and positive health?
Yeah, thanks, Mary. It's such a huge area, but to give a sort of a very brief overview, I think it's fair to say that when we think about health, if you ask somebody are they healthy, very often people will say, well, I'm healthy because I'm not sick. So it's a sort of it's seen as binary, whereas we tend to think of it more in terms of a scale from -10, where you're very unwell or got a significant disease or something like that, to 0, where I'm not ill, but I mightn't be all that well, to +10, which is absolutely thriving. And we reckon we have a very good science of the 0 to -10, but we don't have much of a science of the 0 to +10. So that's really where the positive health focus is. And it's difficult to define positive health because in one sense, it's a journey. It's getting to a point where we feel we're thriving physically, psychologically, socially, perhaps spiritually, mentally, and so on. But it's not just a destination, it's also a journey. Because if I'm unwell and something happens or I do something that makes me feel a bit better, and palliative care would be a very good example of that, that's a positive health journey. So I'm moving in a positive health direction. But I think the bottom line really is that we're trying to say that the focus exclusively on disease and illness in our health system is not sufficient, that there's a whole other dimension to health, which is really well-being, which is the question of how do we thrive and how do we help as many people as possible to thrive.
Great, Ciaran. And it's a very exciting time for our centre in RCSI because we are launching a new programme, the Professional Diploma in Leading Workplace Health and Wellbeing. So, Ciaran, could you say a few words on the genesis of that programme and why the centre is moving into the workplace?
Well, it makes an awful lot of sense for us to look at the workplace, Mary, because so many of us spend so much of our time at work. So work is incredibly important to our well-being. And we've had years and years and years of research on stress in the workplace, burnout in the workplace. So we know a great deal about the downside of work, what happens to people when their work is inimical to their well-being. So the kind of questions that are arising now are more, okay, if you say work is very important, we spend a great deal of our work. Question for workplaces is, how can we create positive workplaces in which our people absolutely thrive? So it's not just a matter of getting by. It's not a matter of not being stressed or not being burned out. It's actually a matter of saying, I can come to work and in this place of work, I absolutely thrive. I'm fulfilled. I have a great sense of well-being. And I think it'd be fair to say there aren't many workplaces around like that yet. So in various parts of the world, this is emerging as a major focus of research. What are the strategies that we can use to create workplaces in which people feel that they're absolutely thriving?
Yes, wonderful. And it is for so many of us, work is a significant part of our lives where we spend a lot of our time. And it makes a lot of sense that it would impact us, not just psychologically, but our physical health also. Yeah. And Ciaran, leadership is at the heart of that. Why do you think leadership plays such a key role in creating positive workplace cultures?
Well, I think the approach, to be fair to say, up to now has been in many workplaces this this whole area is seen as something for HR, for human resources. This is the job of the human resource department. And the approach is very often to make sure, importantly, that work isn't deleterious to people's health. So there's a health and safety issue. There's a focus on not making somebody's mental health, psychological health, physical health, and so on worse for the workplace. And that's fine up to a point. The second part of the HR approach, I think it's fair to say, is to focus on individuals. So we do resilience training, we do stress management training, all that kind of good stuff. But as somebody said to me recently, if you've got sick canaries in a mine, the answer isn't to create more resilient canaries. The answer is to change the mine. So I think a lot of new research is saying that what's most important is the culture of work, the culture of the workplace, and the climate. In other words, how do people experience the culture? And the culture is the job of everybody, improving the culture, but it's particularly the job of the leadership in the workplace. And I mean, by that, I mean everybody. It's not just a HR issue. It's an issue that goes right from the top through the organization. So if we have workplaces where we have initiatives that are designed to make people feel well in work and make them feel better, the research is telling us that those initiatives will work, but only if there's a particular kind of leadership, which we call transformational leadership. And that's a kind of a leadership which adopts a kind of a coaching approach, but is really concerned with creating a culture in which individuals thrive. And that's really, Mary, why I think we've gone with this idea. It's not just about workplace well-being. It's how do we lead organizations, no matter what the level we are in the organization, because everyone has a leadership role. How do we lead organizations where one of the outcomes, in addition to what the bottom line is, whether that's service or profit or whatever, but one of the outcomes is that we have a workforce who are growing, have a degree of autonomy, have a sense of mastery, have good relationships in the workplace, and generally feel that they're thriving.
Yes. Thanks, Ciaran. And I think that becomes even more important with the younger generations, who we know are less stress tolerant. We're seeing higher levels of depression and anxiety, and they will need more supports in the workplace to really thrive and flourish at work. Great. So Amy, we decided for this webinar to focus in on a very important area around workplace well-being, and that is how we deal with grief and loss. So Amy, we'd love to hear a little bit from you around why this area of grief in the workplace, why it is important.
Thanks so much, Mary and Ciaran, and thanks for having me today. And I think, like a lot of what Ciaran said, is exactly the way in which we're thinking about grief in the workplace. You can't talk about death, loss, grief without talking about health. So we know that it impacts our state of health, but equally we know that if you're working in a workplace that keeps you well and allows you to flourish, your health can be a tool to help you cope with life stressors. So it's very much, our program's very much kind of using the World Health Organization and the health promotion focus. But three of the reasons, why it's important would be, firstly, because it's the right thing to do. So, above anything else, ethically, when somebody goes through a loss, it's really important that we care for them and support them. 30,000 people die in Ireland each year, and at least 10 people are impacted by that. And many of those people will be employed. And, depressingly, we spend probably the majority of our waking hours at work, or not depressingly if you're in a great environment.
Yes.
So, it's like actually allowing people to have the supports they need, but to go beyond that and enhance their journey. So, the other reason would be the legal piece. So we're really trying to pitch this in kind of the legal piece. So in the absence of statutory bereavement leave, so there's no entitlement by the state to have bereavement leave. And obviously we advocate for that. But in the meantime, it's looking at where you can support people. And if you're grieving, there is a risk physically and to your psychosocial health, you know, to your psychological health. So we want employers to address this early on, and in doing so actually protect their employee from harm. Because while a death might be a personal issue, if your workplace kind of disenfranchises or doesn't recognize your experience, it becomes a professional one. And equally, if you're put under a huge amount of stress, the likelihood of leading towards burnout or illness, and, you know, not to catastrophize anything, but also accidents. You know, you have to go back to basics and think, well, if you're operating dangerous machinery, if you're working in construction, if you're driving, you know, all those things to think about. So we'd go as far as saying, you know, to recognize this in your health and safety assessment as a potential, you know, stressor and trigger for well-being. And then finally, it's the cost piece. So, you know, we can't always sell it as the right thing to do. So, you know, there's also like a business impact by not caring for your employees when they're experiencing something. So, you know, while you might be concerned about absenteeism, if you actually support someone early on to take the time they need, and maybe later on too, because like we know, grief is unique and it's not a linear journey, you'll actually probably prevent what we call presenteeism. So where somebody's actually coming back to work, they're going through something and they're not meaningfully engaged with their work. And also, like you said, the younger generations now, like they expect more from their workplace around these things. So, you know, it can encourage recruitment, but it can, I think importantly, it can boost morale as well, because if I see my colleague be treated well, I'm going to be a lot more likely to stay in my organization and feel, God, if I experience this, I'll be treated well. So it's all those impacts, you know.
Yes, yes.
Sorry, a
And
long
Amy, no, it is. It's such an important area. And just in our previous conversations, Amy, I probably hadn't fully appreciated all the different types of loss experience. So, you know, everything from people experiencing miscarriage to suicides to obviously bereavement of parents and family members. But even I'd imagine pets, you know, there's so many different types of losses that can really impact people. What's the best advice that you would have for team leaders or people managing others in the workplace when someone is going through has had a bereavement? What's best practice there, Amy?
So I think the very first thing that everybody could take away, you know, even from today, would be obviously to acknowledge the loss for somebody. So sometimes it can be a little bit difficult or awkward, and we get a bit uncomfortable maybe around these topics, but actually acknowledging the loss. And I would say that be it a personal loss or a professional one. So either the death of a colleague or the death of a patient or service user can have a huge impact. So then actually communicating properly with that person. So for a manager, picking up the phone, calling them when they're bereaved, but when they get back to work, having an appropriate return to work process, you know. And I think, you know, Ciaran mentioned culture earlier, and like that's weaved in through our training. Fundamentally, that is one of the most essential things in terms of having a culture that is kind, that allows you autonomy in your job, where there's trust. And in that way, you'll be able to navigate your own losses while still continuing to work. You know, you'll actually be able to keep people well and bring them back sooner. And I'm not saying that that's the ultimate goal. I'm just saying that it has a benefit to the organization and the employee. So that acknowledgement piece, and then having a bereavement policy that acknowledges personal and professional bereavement and loss, if you can stretch it that far, you know, because people experiencing infertility, divorce, pet loss, you know, these have huge impacts on our lives. So that policy piece, and leadership like that, we're all responsible for the culture, but leadership has such a role in embedding compassion into the culture. So that would be my main advice there.
Great. That's really, really excellent advice, Amy. Thank you so much. And Ciaran, just on that compassionate leadership and building a compassionate culture, have you any further thoughts to add on that?
One of the kind of key things, I agree 100% with Amy, it's a great initiative from the Hospice Foundation. And just to say, we in RCSI and the Hospice Foundation have worked for years We have a master's program in bereavement and a diploma in children and loss, and that's been very important, because in healthcare very often we tend to think just of patients and illness and so on, but the family, if the family is the unit of care, then there's a lot more happening with a bereavement, with a death or a loss in that way. So it's great to see this initiative from the Irish Hospice Foundation. In relation to leadership, one of the key ideas in transformational leadership is that the person in the leadership role gets to know their people as individuals. It's not a one size fits all. And I think grief is very complex, and people respond in very different ways, and the trajectory of grief is quite different for different people, or even for the same person over time. So I think it's particularly important for anyone in a leadership or a managerial role to have a sense of people as individuals and be able to sort of modify their own approach depending on what the needs of the person are. So that's one thing I would say. Second thing is, we know from a lot of research that compassionate leadership is really, really powerful in terms of making people feel better in themselves, but it's also powerful in terms of the bottom line. People are more productive, they work better and so on when they're in a compassionate environment, which creates a sense of psychological safety. So in some ways, this is a no-brainer. It just takes time for these different ways of thinking to permeate into the workplace. But who wouldn't want to work for somebody, a manager or a leader, who is authentic, who's compassionate, who takes their individual situation into account, and who is concerned about their development, as well as whatever the bottom line or the productivity or the outcome is from the job.
Yeah, absolutely. And it reminds me of the studies looking at our youngest generation in the workplace, Gen Z, and what they are looking for. There's consensus around, the main factor they are looking for in the workplace is supportive leadership.
Yeah.
Secondly is positive relationships at work, and thirdly, flexibility. But I think those top two really go to that culture, that compassionate leadership that you're speaking about there, Ciaran.
The
So
other thing I just add
yes,
briefly there, Mary, if I may, is that
please.
I think the other way of looking at this, I think for many people, work is a very important way of coping with bereavement and
Yeah.
with grief.
Mm.
So for many people, getting back to the routine of work, getting back into the workplace, getting back in with colleagues and so on is important. So, the workplace can be incredibly valuable, I think, for people dealing directly with grief. I think, I'm not sure if Amy would agree.
Mm.
Actually, it's funny that you say that, because we talk about when you're grieving, there's a model called the loss coping model. So you need to sometimes be with the loss, the emotions around that, the memories of the person, and then there's the restorative side, where you need to distract either consciously or subconsciously to repair yourself and rebuild. And the workplace provides an ideal setting for that. And it's actually, if done correctly, it can be a healing setting, because you've got routine, your tasks, and access to the number one thing, which is social support when you're grieving, and then possibly external supports like your EAP. So I totally agree.
Great. Well, this has been fascinating conversation. I could absolutely listen to you both all day long. But as we come to the end of our session together, our webinar, I'd like to ask each of you, as we typically do in our webinars, what would be your top strategy or your top tip for anyone listening to this who really wants to create that positive workplace culture, really focus on well-being at work? If there was one key strategy, what would it be? So Ciaran, I might go to you first, please.
Thanks, Mary. For me, it's really, if we're anybody who's in a leadership or a management or a supervisory role, if they can broaden their concern for their people to include their well-being, the well-being of their people. And you've sort of two things going on. There's the need to get the job done, obviously, but there's also the need, to look after people, to kind of assist them, to look to their strengths, to see how you can best assist. It's really a kind of servant leadership, I suppose we might call it. Just making that kind of change, cultural change emerges from that. So that would be my main kind of ask of people in leadership or management roles. Know your people as individuals and look to their well-being as well as whatever the bottom line is for getting the job done.
Great. Very sage advice. Thank you, Ciaran. And Amy, what would your key strategy be?
It would probably be that I would have actually said something around kind leadership, but Ciaran was centered around that. So it probably would be that resilience in your workplace is more about the environment and the organization, the system you're operating in, than the individuals. So that you can give people all the individual education and training you want, but if they can't put, say, for example, their grief training into play because the environment isn't compatible with that, then problems occur. So really look at that piece if you want to have change, essentially positive change for well-being. So thank you.
So my thanks to Professor Ciaran O'Boyle, Director of the RCSI Centre for Positive Health Sciences, and to Amy Gibney, National Coordinator of Grief in the Workplace and Grief Awareness with the Irish Hospice Foundation. Thanks to you both for sharing such wisdom and insights on our webinar today. If you've enjoyed the conversation and are interested in learning more about leading workplace health and wellbeing, a reminder that our professional diploma will be launching this autumn, and we are accepting registration of interest at the moment. If you'd like to find out more about the new professional diploma, please go to our website. It is www.rcsi.com/CPHS. This is a level 9, 9-month professional diploma. It's a part-time professional diploma comprising of 3 core modules. And this professional diploma is aimed at anybody interested in fostering a culture that supports workplace health and well-being. So we're inviting applications from people working in HR, workplace well-being coordinators, people leaders, anyone really who has that interest and wants to make a difference in the area of workplace health and well-being. Thanks so much to everyone for joining us on National Workplace Wellbeing Day. I hope you have a great day, and if you would like to view the recording and also to access the resources that were mentioned during our webinar, you can find those on our social media platforms. So thank you all so much, and we look forward to you staying in touch with the Centre for Positive Health Sciences at RCSI.